Leukemia is a cancer that starts in the early blood-forming cells, usually the white blood cells. Bone marrow cells can turn into leukemia, and leukemia can become metastatic very quickly.
There are 4 types of leukemia that can be split into 2 categories. The first is acute, which is fast-growing, and the second is chronic, which is slow-growing. Each of these 2 groups can be split into either lymphatic leukemia or myeloid leukemia. Acute leukemia cases are more common in little kids ages 2 to 4, with survival rates being between 60 and 85%. Chronic leukemia cases are more common in teenagers, with survival rates being between 60 and 80%.
The cause of childhood leukemia is unknown, but there are a few risk factors that may lead to the disease. If your child has genetic disorders, inherited syndromes, or immune system problems, they are susceptible. If you or your child's siblings have leukemia, your child has a greater chance of developing the disease. Finally, if your child is exposed to radiation or chemotherapy, this can lead to the development of leukemia.
It is likely that the symptoms are caused by an infection, but further testing will deduce whether or not your child has developed leukemia. Doctors will perform blood tests to determine the white blood cell counts, which will be significantly higher in leukemia patients. If this is found, a bone marrow aspiration and biopsy will be performed. A spinal tap will also always be performed. This test could be used to determine if cancer has metastasized, or it may be used to administer chemotherapy to the cerebrospinal fluid.
The main treatment for childhood leukemia is chemotherapy. For higher risk leukemia cases, patients are given a higher dose of chemotherapy and stem cell transplant. In special cases, leukemia patients are given targeted drugs, surgery, and/or radiation.
Experimental clinical trials have been performed to determine appropriate ways to treat patients who have stopped responding to the treatment methods that are available. In these trials, doctors extracted blood samples, then altered the immune cells and placed these altered cells back into the patients. These cells then multiplied and attacked the leukemia cells. Those in the field see this as a promising treatment that allows doctors to use their patients' own immune cells to fight the disease. Scientists have been studying genetic changes that lead to cancer. The Cancer Genome Atlas Project has published findings that improve our understanding of the gene changes that are involved in acute leukemia.
Thank you for watching!